Okay, crutch use. So a patient's typically going to use crutches when they're not able to bear weight on their injured leg. You can also use crutches when you're trying to immobilize a joint to avoid putting weight on that joint. Yeah. So first, you're going to have the patient let you know how tall they are. 5'6". Okay. So she's 5'6". At the very bottom, you're going to adjust the height to their height. Thank you. The same for both. Then they will place the crutches 2 inches forward from their toe and 6 inches out to the side. And then you'll be checking the distance of the handles and making sure their elbows create a 30-degree angle or line up with the crease of their wrist, and making sure that there's a 3-finger length from the top of the crutch to the armpit so that it's not digging in there, and so they're not putting weight in through their armpits. Then there's 2 different types of crutching. So you have non-weight bearing and partial weight bearing. With non-weight bearing, the patient is going to reach the crutches out about a foot forward or however comfortable they feel. And with their injured leg kind of elevated off of the floor, they're crutching with their good leg to the crutches, avoiding a crutch through to avoid potential risk of more injury. And yeah, making sure to put all their weight in through their hands and not the armpits. And then partial weight bearing, similar idea. The patient's going to have the crutches reached out about a foot forward, and then with their injured leg, they're stepping to the crutch with partial weight, and then putting the other half of the weight through their hands, and then stepping through with their good foot. Good job. Then stairs, there's kind of 2 options for this. They can either have crutch on both sides or both crutches on one side and using the rail to assist. So on the way up, they will step up with their, leaving the crutches at the same level they are. They'll step up with their good foot as their injured foot is still elevated, and then bring the crutches back up to meet their good foot. And then on the way back down, they basically do the opposite, where the crutches will go first and then the foot. And this helps avoid any tilting forward or backward so that they don't fall down the stairs. And then the patient would no longer need to use crutches if they can put weight on their foot without pain or their injured leg without pain. They've seen a physician and have been cleared by them or have been given a timeline